Well, good afternoon. I'm Bevan Baker. I'm the City of Milwaukee Health Commissioner, and thank you for joining us today. Today, the City of Milwaukee Health Department is reporting the fourth death related to the novel H1N1 infection. This is the fifth such death in Wisconsin. This case involves an adolescent who had a common underlying medical condition which made them more at risk to the complications of influenza. We won't provide any additional specific health information in accordance with our internal policy of federal law. I wanted to also make mention of the fact that we continue to get daily reports on new cases, and while that's declined significantly from our peak case count, we expect that as the summer ends that we could see these numbers ramp back up again this fall. As we've stressed throughout the investigation of H1N1, there is no immunity for anyone, and there's currently no vaccine available. We've also said that our hospitalization rates for H1N1 are different than those for regular seasonal influenza. Typically, seasonal influenza has less than 1% of hospitalization. We're seeing 1 to 2% with H1N1. Now, we also recognize that influenza viruses can mutate, and they can change their behavior. And it's important to note that H1N1 acts differently than regular seasonal influenza. And that's why we are continuing to refine our pandemic response plan. We are preparing and working with state and federal authorities for mass vaccination this fall. The vaccine should be available. And we will reserve the right to return to a more aggressive social distancing measures, and if our public health surveillance leads us in that direction. What we will need from the public is their cooperation, their support, and their understanding as we look to a fall schedule of addressing H1N1 in our community. I want to reiterate that H1N1 continues to be a serious concern throughout the nation and within our community. I urge everyone to follow the recommendations that we've issued on how to slow the spread of this disease. And I want to emphasize, as I've said many times before, please stay at home if you're exhibiting symptoms, signs of respiratory illness, fever, cough, or sore throat. Stay at home from any type of event that you believe that you could compromise others. And practice good and safe hygiene practices. Cover your cough and sneezing. I will take a few questions now.
Why do you guys think it will get worse after the summer? And then when you say more aggressive actions, do you mean schools, closing schools and those type of things that we saw a few months ago?
Well, the federal government just concluded a flu summit just last week, and we watched that summit. And we understand that sometimes there's a waning transmission of influenza during the summer months. We're watching very closely what's happening in other parts of the world now. And we typically know that during regular seasonal influenza, which could happen during the fall and winter months, there's a possibility that our transmission could peak back up as it has trailed off this summer. The other thing is that we may have large congregations of school-aged children who are great carriers and spreaders of disease. So we're hoping that we will curb this disease. It won't come back, but we're prepared.
Is this victim have any connection to any of the other victims? Did this victim go to school with the other victims, or any connection?
The only data that we have is this is an adolescent who had underlying medical conditions. There's no data to suggest any connection to any other cases that we described.
Can you tell us if this adolescent was in the hospital at all, if was treated at all?
What we can say is that this adolescent died within the last 24 hours and was receiving care at a local medical facility.
Last 24 hours from now, or last 24 hours from when?
24 hours from now.
Can you tell us at all about that underlying medical condition?
Well, it is one of those medical conditions that we mentioned before that would make one more susceptible to complications of influenza. That does not change our information that we're putting out today. This was not an individual who was healthy and didn't have any other conditions. That's all we'll state.
Some of these cases, not this one we know of yet, but some of the earlier ones had showed up as pneumonia and seemed that maybe it wasn't quite caught early enough. Are doctors or hospitals getting the information now that if people are showing up with pneumonia-like symptoms that they should be tested for
What
this?
we're hoping and what we have stated in the public health community, that our medical providers think flu first. We know it's summer, but think flu first. We believe that our community has been properly notified that H1N1 is widespread and circulating throughout Wisconsin. And we believe that medical professionals today are taking the appropriate action. But we also need individuals to take the appropriate action and call their provider if they believe that they're exhibiting symptoms. We need both of those things to happen for there to be a good prevention strategy.
So you guys are still recommending that people call if they have symptoms rather than going in to prevent the spread?
We always want individuals to have a relationship with their medical provider and to call to protect both others who are seeking medical attention for additional issues, but also to have that consult to not crowd our healthcare delivery system. It makes more sense for the doctor to make that initial assessment via phone if they can and triage it, and then get you in if you're well enough to self-ambulate.
Is there an accurate number of confirmed swine flu cases that have come through this office or the state of Wisconsin we have there?
We currently have 3,268 confirmed cases in the city of Milwaukee. We have, as of last evening, 6,011 or so cases throughout Wisconsin. That number may have fluctuated slightly, but we're well over 6,000 cases for the state of Wisconsin. But I do have the accurate number for the city as of this time.
Are we still the highest in the country?
Wisconsin still has the most cases, and we have, as the city of Milwaukee, the most cases of any metropolitan city and more than just about any state.
As health commissioner, does this continue to give you concern at all that here's another victim who doesn't fall in that range of over 65 or under 5?
Well, certainly our data is trending with some of the national data to suggest that those that are younger are being impacted, but all ages are being impacted. But it does require us to have pause, and that's why we're looking at all this data. And we're excited about finding out more from analyzing this data as we prepare for the fall pandemic response. If there are no other questions, thank you all.